It was just a mild headache. But for 68-year-old Frank, that small, seemingly insignificant symptom was the first sign of a life-threatening condition that nearly cost him his life. As we age, our bodies start sending us subtle warning signals. Signals that many of us often ignore, thinking they're just part of getting older. But did you know that certain symptoms could be the difference between life and death? Doctors are clear. After the age of 60, you must pay close attention to these critical warning signs. Ignoring them could be fatal, but taking action early might save your life. In this article, we'll uncover 6 essential warning signs that demand immediate attention, helping you take control of your health and make the right choices when it matters most. If you are not subscribed, subscribe and activate the notification bell so you don't miss any videos. 1. Unexplained extreme fatigue. Unexplained extreme fatigue is a common concern, particularly among older adults, but it differs significantly from the typical tiredness one experiences after a long day. While ordinary fatigue is often resolved with rest, unexplained, extreme exhaustion could signal an underlying health issue that requires urgent medical attention. If you find yourself feeling completely drained despite getting adequate sleep, or if tasks you once completed easily now leave you feeling utterly fatigued, it could be a sign that your body is struggling. Many people assume that fatigue is simply a part of aging, but medical experts caution that persistent and overwhelming tiredness might indicate a more serious health problem, such as heart disease, kidney failure, or even advanced cancer. For example, heart failure often leads to extreme fatigue as the heart becomes less efficient at pumping blood, resulting in weakness and a lack of energy. Similarly, conditions like cancer or kidney failure can accelerate the depletion of the body's energy reserves, making even simple activities feel exhausting. If you begin to experience unexplained fatigue, it's important to track when the symptoms started, whether they are worsening over time, and how much they are affecting your daily life. For instance, if you notice a significant decline in your energy levels, and activities like walking, cooking, or completing routine tasks feel overwhelming, it may be time to seek medical advice. Consulting a doctor early on is essential, as it can lead to earlier detection of potentially serious health conditions. Timely intervention can make a substantial difference in treatment outcomes, and it's better to address unexplained fatigue sooner rather than waiting to see if the symptoms improve on their own. 2. Sudden and severe chest pain. Sudden and severe chest pain is one of the most concerning symptoms that should never be ignored. Unlike the mild discomfort you might feel after eating something spicy or engaging in physical activity, this type of chest pain is often described as a deep, crushing, or squeezing sensation. It may radiate to other areas such as your arm, neck, jaw, or back, and it is typically a sign of a medical emergency. When chest pain occurs alongside other symptoms like shortness of breath, nausea, dizziness, or sweating, it could indicate a heart attack or an aortic dissection. Unfortunately, many people mistakenly attribute this pain to something less serious, like heartburn or muscle strain, and delay seeking medical help. This delay can be fatal. For example, an aortic dissection, where the body's largest artery tears, is a life-threatening condition that requires immediate surgical intervention to prevent death. If you experience sudden chest pain, the most important thing is to act quickly. Don't lie down and wait for the pain to subside. Instead, seek immediate medical attention by calling emergency services. The faster you receive help, the higher your chances of survival. Time is critical when dealing with serious heart conditions or aortic dissection, and prompt action can significantly improve the outcome. Always err on the side of caution and get checked by a healthcare professional if you experience severe chest pain. 3. Difficulty breathing or shortness of breath. Breathing is something most people take for granted, but when it becomes suddenly difficult or when you can't catch your breath, it's a serious warning sign that demands attention. Sudden shortness of breath, especially when you're at rest, often indicates a critical health issue, such as heart failure, a pulmonary embolism, a blood clot in the lungs, or even a silent heart attack. While some may assume that breathing difficulties are just a normal part of aging, it's important to recognize that they can point to more severe conditions. For instance, shortness of breath could be a result of a pulmonary embolism, where a blood clot becomes lodged in the lungs, preventing oxygen from reaching the bloodstream. This can occur unexpectedly, particularly after extended periods of inactivity or following surgery. Another common cause of breathing difficulties is congestive heart failure. In this condition, the heart struggles to pump blood efficiently, leading to a buildup of fluid in the lungs. This can cause you to feel breathless, especially when lying down, and in some cases, people even wake up gasping for air during the night. If you suddenly experience difficulty breathing or feel out of breath, don't delay in seeking medical help. Both pulmonary embolism and heart failure can be life-threatening without fast intervention. Immediate medical attention can significantly improve your chances of preventing a more serious, potentially fatal event. Always take sudden or severe breathing issues seriously and get checked by a healthcare professional as soon as possible. 4. Drastic and unexplained weight loss. Unexplained and drastic weight loss is a concerning symptom that should never be ignored. While many people actively seek to lose weight through diet and exercise, unintentional weight loss, especially when it happens suddenly and without any obvious lifestyle changes, should be viewed as a warning sign of a serious health issue. If you find yourself shedding pounds despite no changes to your eating habits or physical activity, it could indicate a much deeper health problem, such as cancer, metabolic disorders, or even heart failure. One of the most common causes of unexplained weight loss is cancer. Certain types of cancer, particularly those affecting the pancreas, lungs, or digestive system, are known to cause rapid and unexplained weight loss. When the body is fighting cancer, its metabolism can change drastically, causing the body to burn through its energy reserves at a much faster rate. This occurs as the body attempts to combat the disease, which can lead to significant weight loss over time. However, it's not just cancer that can lead to drastic weight loss. Metabolic disorders and other chronic conditions can also have similar effects. If you are still watching this video and find these lessons useful, please comment 1 below to let me know that you are still here with me. For example, undiagnosed diabetes can lead to weight loss due to the body's inability to properly process glucose, causing it to break down muscle and fat for energy instead. Similarly, heart failure can interfere with the body's ability to circulate blood effectively, which can impact metabolism and cause unexpected weight loss. Infections, especially chronic ones, can also result in weight loss, as the body's immune system works overtime to fight off the illness. If you notice unexplained weight loss, it's important not to dismiss it as something related to stress, aging, or a temporary change in your routine. Even if you're not intentionally trying to lose weight, rapid weight loss can signal an underlying health problem that requires immediate attention. Specifically, if you've lost more than 5% of your body weight within a short period, whether it's weeks or months, it's essential to consult a doctor. The sooner you can identify the cause, the better your chances of addressing any serious health conditions before they become more difficult to treat. By seeking medical advice early, you can begin a course of treatment or management strategies that could significantly improve your health and quality of life. Whether it's through medication, lifestyle changes, or even surgery, early detection and intervention can make all the difference. Therefore, don't wait for unexplained weight loss to resolve on its own. Schedule a checkup with your doctor to ensure you receive the proper evaluation and care. Addressing the issue early could lead to better outcomes and prevent more severe complications down the road. 5. Confusion, disorientation, or sudden personality changes. A sudden shift in your mental state is an alarming sign that something serious could be happening within your body. If you or someone you know begins to experience confusion, disorientation, memory loss, or noticeable personality changes, it's important to take these symptoms seriously, as they could be indicative of a stroke, brain infection, or neurological disorder, such as dementia. One of the most concerning causes of sudden mental changes is a stroke. A stroke can lead to confusion, slurred speech, difficulty recognizing familiar people or places, and even partial paralysis. While these symptoms may sometimes be brief, lasting only a few minutes, they should never be ignored. A transient episode could still indicate that the brain is not receiving adequate blood flow, and even if the symptoms seem to resolve quickly, it's essential to seek immediate medical attention. Early intervention following a stroke can significantly improve the likelihood of a full recovery and reduce the chances of long-term brain damage. In addition to strokes, certain infections that affect the brain can also cause sudden mental decline. For instance, urinary tract infections, UTIs, which are common in older adults, can lead to delirium, a state of acute confusion or disorientation. UTIs may not always present with the typical symptoms of fever or pain, especially in older individuals, but confusion and changes in mental status can be key warning signs. This confusion should not be dismissed as a normal part of aging. Delirium caused by infections can be treated effectively with prompt medical care, and delaying treatment can lead to further complications. It's important to understand that sudden confusion or personality changes should never be considered a normal part of aging or a temporary issue. If you or a loved one experiences a noticeable and sudden decline in mental function, it's critical to seek medical help as soon as possible. Whether the cause is a stroke, an infection, or something else, quick intervention can make a significant difference in the overall outcome. Early diagnosis and treatment can prevent further deterioration and improve the chances of recovery, ensuring that the individual receives the proper care they need before the condition worsens. 6. Severe and persistent abdominal pain. Severe and persistent abdominal pain is a symptom that should never be taken lightly. While mild abdominal discomfort can be common and often caused by temporary issues, pain that is intense, lasts for hours, or comes on suddenly is a serious warning sign of a potential medical emergency. If the pain feels deep, sharp, or doesn't improve with time, it may be a signal that something more dangerous is happening within your body. One of the most life-threatening conditions that can cause severe abdominal pain is a ruptured abdominal aortic aneurysm, AAA. This condition occurs when there is a tear in the aorta, the body's largest artery, which can lead to massive internal bleeding. A ruptured AAA often results in sudden, deep, and pulsing pain in the abdomen, lower back, or sides. This is a medical emergency that requires immediate attention, as it can be fatal if not treated quickly. The pain associated with an AAA is often severe and sudden, making it critical to seek help as soon as possible to prevent catastrophic consequences. Other serious causes of persistent abdominal pain include intestinal blockages, pancreatitis, inflammation of the pancreas, or gallbladder attacks. Each of these conditions can cause excruciating pain and require swift intervention to prevent complications or potentially life-threatening outcomes. For example, an intestinal blockage can cause severe cramping and bloating, and if left untreated, it may lead to tissue death or infection. Pancreatitis, on the other hand, can cause intense pain in the upper abdomen and may result in severe complications if not addressed immediately. Gallbladder attacks, often marked by pain in the upper right abdomen, can also escalate quickly and require emergency treatment. If you are experiencing persistent or severe abdominal pain, especially if it is accompanied by other alarming symptoms such as fever, vomiting, weakness, or dizziness, do not hesitate to seek emergency medical care. The longer you wait, the greater the risk of complications, so it's essential to get medical attention right away. Early diagnosis and intervention can prevent further harm and significantly improve the chances of recovery. Always take severe abdominal pain seriously and act swiftly to ensure the best possible outcome. As we've explored today, paying attention to sudden and unexplained symptoms can be the difference between life and death. From extreme fatigue and sudden chest pain to unexpected weight loss and severe abdominal discomfort, each of these warning signs could point to a serious underlying health issue that requires immediate medical attention. What have you learned so far? Is there something you didn't realize before, or a piece of information that you'll now bring into your daily life for better health awareness? We'd love to hear from you. Please comment below and let us know one thing you've learned from this video that you'll be more mindful of moving forward. If you enjoyed this video, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more helpful tips and health advice. Stay safe, stay informed, and take care of yourself and those around you.